Welcome. Today we are diving into the topic of chronic bronchitis. This is a persistent lung condition that involves inflammation and narrowing of the airways, making it a challenge for air to freely flow in and out of the lungs. The key symptom? A chronic cough, bringing up mucus that can be clear, white, yellow, or even greenish. But it doesn't stop there. Shortness of breath, especially during physical activities, and frequent respiratory infections are also common companions of this condition. The root cause of these symptoms is the swelling of the bronchial tubes, the air passages that carry air to and from the air sacs in your lungs. This inflammation causes an overproduction of sticky mucus, further blocking these airways, making breathing an uphill task. Now, imagine trying to breathe through a narrow straw while having to clear it of its blockages constantly. Not an easy task, right? That's what living with chronic bronchitis can feel like. It can turn simple everyday tasks into exhausting endeavors. But here's the silver lining. With the right approach, managing chronic bronchitis and its symptoms can become a more achievable task. One effective strategy is pulmonary rehabilitation. This is a comprehensive program that combines education, exercise training, nutrition advice, and counseling, tailored to your specific needs. The goal? To help you breathe easier, increase your endurance, and improve your overall quality of life. Remember, chronic bronchitis is not just about managing symptoms. It's also about understanding the condition, its triggers, and learning how to navigate everyday life with it. It's about arming yourself with the right knowledge, tools, and strategies to manage it effectively. With the right strategies, managing chronic bronchitis becomes a more achievable task. So stick around as we continue to explore this topic further in our next video, where we will delve into the causes and risk factors of chronic bronchitis. So, what causes chronic bronchitis? Chronic bronchitis doesn't just appear out of the blue. It's a consequence of certain triggers that create an atmosphere conducive for it to thrive. We're talking about irritants that you might be breathing in daily, such as tobacco smoke, air pollution, and dust. Now let's talk about smoking. It's not just a risk factor, it is a significant one. The toxic chemicals in cigarette smoke are like a party invitation for airway irritation and inflammation. So, if you're a smoker, you're essentially rolling out the red carpet for chronic bronchitis. But it's not just smokers who are at risk. Let's say you work in an industry where you're constantly exposed to dust or pollutants. That's like being in the front row of a rock concert, except the band is chronic bronchitis and the music is a persistent, nagging cough. So, if you're looking to manage chronic bronchitis effectively, minimizing exposure to these irritants is the name of the game. If you smoke, consider quitting. Trust us, your airways will thank you. And if you're working in a polluted environment, think about protective measures. You wouldn't go into a thunderstorm without an umbrella, right? So why face pollutants without a mask? But remember, exposure to these irritants isn't a guarantee that you'll get chronic bronchitis. It's more like adding fuel to a potential fire. There are other factors at play, like genetics and your overall health. So don't panic, but do take precautions. In the end, understanding the causes and risk factors is like having a map. It shows you where the pitfalls are and how to avoid them. And just like any journey, the more you know about the terrain, the better prepared you are to navigate it. Remember, minimizing exposure to these irritants is a crucial step towards managing chronic bronchitis. Excessive mucus production can pose a real challenge in chronic bronchitis. This sticky, thick substance is produced by the body as a defense mechanism against the irritants that trigger bronchitis. But when produced in excess, it can lead to airway congestion and difficulty in breathing. Let's take a moment to understand the role of irritants in triggering this overproduction of mucus. Cigarette smoke, pollution, dust, these are all culprits that can irritate your airways and stimulate an overproduction of mucus. The body's reaction to these irritants is to produce more mucus to trap and expel them. However, in chronic bronchitis, this defense mechanism goes into overdrive, leading to an excess of mucus that can clog the airways and make breathing difficult. But don't be disheartened. There are several ways to manage this excessive mucus production. Medications, chest physiotherapy, and pulmonary rehabilitation are all effective strategies. Medications like mucolytics can thin the mucus, making it easier to cough up, while chest physiotherapy can help physically move the mucus out of your lungs. Pulmonary rehabilitation, on the other hand, can help improve your lung function and capacity. helping your body more effectively clear the mucus. Hydration is another key factor in managing mucus production. Drinking plenty of water can help thin the mucus, making it easier to expel. A humidifier can also be helpful, as it adds moisture to the air you breathe, helping to loosen the mucus. Avoiding irritants is also fundamental. Quitting smoking, staying away from polluted environments, or wearing a mask when you can't avoid these irritants can all help reduce the stimulation of mucus production. Remember, every person is unique, and what works best for you may not be the same as what works best for someone else. It's important to work with your healthcare team to develop a personalized plan that suits your needs and lifestyle. With these strategies, you can effectively manage mucus production and breathe easier. The persistent cough in chronic bronchitis can be quite bothersome. It's like having an unwanted guest that overstays its welcome. But why do we cough so much when dealing with this condition? Well, it all boils down to inflammation and irritation in the airways. Imagine your airways are like a two-lane highway. Now, if there's a traffic jam or roadwork, things can get pretty congested, right? That's what inflammation does to your airways. It narrows them down, making it harder for air to pass through. This, together with the irritation caused by mucus buildup, triggers a coughing reflex, your body's way of trying to clear the airways. But fear not, there are several ways to alleviate this persistent cough. First off, medications can be a big help. Bronchodilators, for instance, work by relaxing the muscles around the airways, allowing them to open up for easier breathing. This can minimize the irritation and subsequently reduce the coughing. The second strategy involves making some lifestyle changes. Smoking cessation is a significant one. Remember, cigarette smoke is like adding fuel to the fire when it comes to airway inflammation. Quitting smoking can help calm the irritation and lessen the cough. Thirdly, hydration is key. Drinking plenty of fluids helps to thin the mucus in your airways, making it easier to cough up. This can be further helped by using a humidifier, especially during dry or cold weather when the air can dry out your airways and thicken the mucus. Lastly, let's not forget about the importance of professional help. Working with healthcare professionals can provide you with a tailored approach to manage your symptoms effectively. They can guide you on the right use of medications, suggest suitable lifestyle changes, and monitor your progress. So while the persistent cough in chronic bronchitis can be quite bothersome, it doesn't have to rule your life. Addressing the chronic cough requires a comprehensive approach, but with the right strategies, it can be managed effectively. So, let's get that unwelcome guest to finally pack its bags and give you some peace. Shortness of breath can significantly impact daily life. This common symptom of chronic bronchitis occurs due to the inflammation and narrowing of the airways, which makes it harder for air to flow in and out of the lungs, especially during physical activities. But don't despair. There are several strategies to manage this. Medications like bronchodilators can help open up your airways, making it easier to breathe. Pulmonary rehabilitation, a tailored program of exercise and education, can also significantly improve your lung function and reduce shortness of breath. In addition to these medical interventions, lifestyle modifications play a critical role. Regular exercise can strengthen your respiratory muscles, while avoiding irritants like cigarette smoke and dust can prevent further inflammation and narrowing of your airways. Remember, every breath counts and every step towards managing your symptoms matters. Improving lung function and reducing shortness of breath can greatly enhance your quality of life. Let's explore the role of herbs and essential oils in managing chronic bronchitis. Many people turn to natural remedies to soothe symptoms and enhance their overall well-being. English ivy and sea moss, for instance, are known for their potent properties that may help ease bronchospasms and soothe the respiratory system. Eucalyptus oil, with its invigorating scent, is often used in steam inhalation to provide temporary relief from congestion. Then we have herbs like turmeric, ginseng, and astragalus. These are believed to boost the immune system and reduce inflammation, providing an additional line of defense against the condition. But remember, it's crucial to always consult with healthcare professionals before starting any new treatment. They can guide you on the right path, ensuring these remedies are safe and suitable for your specific condition. While these natural remedies can offer relief, they should only complement, not replace, conventional treatment.